This year, the East Injury Control and Prevention Committee has partnered with Orlando Health to come back to William R. Boone High School for our outreach event. We were last here in 2020, and we wanted to come back and continue the relationship that we have developed with Boone High School. So this year we have three main events that we're putting on for a group of high school students. The first is a Stop the Bleed session, where the students learn how to prevent bleeding in the event that they come across somebody who has been injured. The second is a distracted driving session, where we focus on number one, what is distracted driving? We have some distracted driving simulators that the students can practice on to see what it feels like to try and drive a car while they're getting text messages or there are other distractions around them. We also have some impaired driving goggles that they're using to simulate what it would feel like to walk around while impaired and try to do a task or play a game that requires focus. And then we're doing some trivia related to distracted driving. And then lastly, we have partnered with an organization called Think First for a trauma survivorship session, where we're having some survivors of injury come in and talk to the students about what their injury was, what happened to them when they were injured, and then what everything in their life looked like from the point of that injury up through their hospitalization and through their recovery and what their lives look like now. And that's a really amazing opportunity for the students to ask questions and to really have a firsthand interaction with someone who's been impacted by trauma.
Boone High School is pretty unique in that they have this separate academy for health sciences. And so these are students that are actually interested in going into fields in the medical profession. It's showing them what we do on a daily basis and showing them that you can really make an impact on people's lives, which is really important.
Here at Boone, we have a 4-year program for students who are interested in healthcare, and our focus is on getting them into a healthcare career that they'll enjoy. So they have an opportunity to learn about the body with anatomy and physiology. They learn about different health careers and the education and training it takes to get there. And then they learn practical skills.
Orlando Health has provided a lot of opportunities for this program. We've been able to go to the hospital, see a lot of different health careers, kind of get an idea of what you would like to do in the future.
So being in this program gave me this huge opportunity to see things you would not see on a daily classroom. Got to do so many hands-on activities, see things face to face, and I think that really helped my career choice. I want to be a nurse in the future.
I've always wanted to be a nurse because I think when I did the clinicals for the Orlando Health, it helped me like be more interested in it. It shows me like different rotations. It showed us like how different bleedings happen from even a trauma or even a small like surgery. Being a nurse, saving a life is a very noble job.
Stop the Bleed is a national program that all trauma centers are really trying to put out there into the communities. It's a program where you teach civilians how to stop the bleed, and so in this case, we have students here that if they see an injured civilian on the side of a road, or there's a casualty event, that they're able to go out there and they know how to put on a tourniquet, they know how to pack wounds, and so they know how to stabilize those patients so that then they can get them to the hospital for trauma surgeons and providers to take care of those patients.
It's important for us to do these because we've had, so many incidents, whether it's a one-on-one event or a mass casualty event. We've had so many that have happened. We want to actually have people out in the community that can render aid before first responders arrive.
After an injury, the number one preventable cause of death is bleeding. And as many of us at East know, Traumatic injury from car crashes, from gun violence is really common in the United States today. And all of these students may be in a situation one day where they are the first person on the scene with a patient who has been injured and is bleeding. Stop the bleed techniques are simple, they're not complicated, and they're things that anyone can learn how to do, but you have to learn how to do them. And if you do, you have the ability to save a life.
So if you see somebody with a laceration with Trauma East, if you have like any type of bandage or shirt or cloth or anything, you can kind of pack the wound, stop the bleeding, put pressure, obviously call for extra assistance and help.
What I like about this event is all the hands-on activities we get to do, like the one behind me, Stop the Bleed. Basically, you're on the street, you see someone bleeding out, you're the person that can take the lead and help them out. You can tell a person, oh, call 911 while you're the one doing stopping the bleed, packing the person, you can save their life, and it's all thanks to this event.
For distracted driving, we're teaching students how to get to the place they need to get safely as possible as young, inexperienced drivers. So we're teaching them what happens when they're distracted from things like drinking or texting or having even simply conversations with their friends in their cars. So we really want to make sure that we make an impact on their safety as much as possible.
These students are at the age where they're getting their driver's licenses and they are going out into the world. Some of them have their own cars, some of them will have their own cars in the future. And they are just developing their habits as drivers. Everybody has a cell phone. Everybody knows what it's like to be distracted by their cell phone. But what we want to focus on is the importance of developing good driving habits that do not involve texting while driving, being on the phone while driving, being in a car with a bunch of loud friends or loud music that could distract them. We really want to instill in these students responsible driving habits at the point where they're just learning how to drive. And similarly, we want to talk to them about impaired driving, which is, as everyone knows, a really significant problem within the United States. And we want these students to understand the impact of deciding to get in a car after drinking or after using drugs and what that could mean for their life, as well as what that could mean for the lives of everyone around them.
The event, it provides a lot of information on how to drive safely, the precautions that you should take while driving.
Because we see how it affects being on your phone or like having friends in the background, we see how it affects your driving, so we know not to do that. We have a better sense of it, really.
Probably the most impactful session this year is the Trauma Survivorship session. The opportunity to speak with somebody who has sustained an injury and then had to go through both the physical recovery as well as the mental and emotional recovery that comes after that injury. Having the opportunity to speak with survivors' family members and hear what that event was like and how it changed the family's entire life. Those are the types of conversations that I think will really stick with the students and maybe the thing that makes them change their behavior or think a little harder about their behavior in the future.
I come and I talk to the students just about your body and how important it is to protect it, how injuries can happen, and that it's really about choices, making good choices. So we talk about things from wearing a seatbelt to wearing helmets, diving injuries, things like that, and telling them that you have a choice, really thinking about the choices that you make. Then Crystal is our speaker today, and she comes and tells her story, talks about she was in a car crash and how it happened, what her rehab was like, and what her life is like today.
I am here today because I was in a fatal car accident on May 24th, 2009. And I am telling my story to high school students that want to learn more about nursing and along the lines of brain injuries and spinal cord injuries. My life has changed dramatically. I used to play sports. I used to farm with my dad. And I was going to school to become an athletic trainer. And because of this accident, I can't do any of those things anymore. If they can just take home anything, I would want them to take home that they don't have to make that decision to drink and drive or text and drive.
So our slogan this year is "Being brave saves lives." And I like to think of that in terms of the decisions that we're asking students to make. You know, making those decisions in the moment can be really difficult, and it takes bravery. It takes internal strength to say, you know, I'm not going to get in a car after drinking. I am going to turn off my cell phone and not look at it while I'm driving a car. And if students learn to make those small, brave decisions, they could save their own lives and they could save the lives of their friends and families.
So being brave saves lives because, of course, they're the Braves here at Boone High School. We think that introducing them to something like Stop the Bleed actually can show if they are brave, they would be able to assist. So if they have the courage, if they learn the skills, would they have the courage to actually step in and help a victim?
It's really about just being brave and standing up for what's right. And so in terms of, you know, if these kids are at a party and there's alcohol involved, or, you know, they're texting, their friends are texting and driving, and it's showing them that they have the courage to say no to that.
Being brave saves lives. It means that if you see an accident or somebody that is in need of help, be brave, go help them. Use what you learned today to help them out, be safe. Maybe if you're brave and you help them out, maybe you'll save their life.
You know what to do. Like, you're not gonna have to ask someone about it, and you have more courage.
You have to be able to take charge. You can't be afraid to jump in. You just have to go for it. You have to do it. You can save a life just for being brave.
Really what we're trying to get to is that the students have the power to make sure that they're safe, their friends are safe, and their family and loved ones are safe.
This is what I see day in and day out. We see, just really challenging situations. Some of my worst days are when I have to tell parents that their kids aren't coming home. And as a mother of 3 children myself, I think, being here and talking to these students, if there's, just one student that you can change their mindset and, make them choose a different path, then, my job's done for today.